Hello, welcome to the second lecture of the Dental TV Clear Align Master Course, and I'm Lee Jong-duk from Apgujeong Oracle Dental Clinic. Today's topic is the first step in clear aligner treatment. Many dentists who are new or less familiar with clear aligners often find themselves wondering how to start learning clear aligner treatment. Through today's lecture, I'll guide you step by step on how you can get started with clear aligner treatment. In clinical practice, I believe there are two major concerns when it comes to clear aligner treatment. First, determining which cases you should start with. And second, worrying about potential issues that might arise during treatment. These are probably your biggest concerns. When studying clear aligner treatment, it's best to address each of these concerns one by one. If you're unsure about selecting appropriate cases for clear aligner treatment, it's important to develop the ability to assess case difficulty accurately. Just as a good batter learns to distinguish between balls and strikes, enhancing your judgment will allow you to identify cases that match your clinical skills. Another common concern is, what if something goes wrong during treatment? But if you take preventive measures before any issues arise, you'll achieve better treatment outcomes. Moreover, if an unexpected tooth movement or issue does occur, having effective solutions will greatly help you overcome these challenges. In a broad sense, addressing these concerns will greatly help you to get started with clear aligner treatment. Now, to help you perform clear aligner treatment effectively, I've summarized the key points as follows. As mentioned earlier, case selection is extremely important. Choosing the right cases leads to successful treatment outcomes. You need to become proficient in deciding which cases to select. Once you've selected a case, accurate diagnosis is critical. In clear aligner treatment, the diagnosis is considered same as filling out an order for clear aligners. An accurate diagnosis is the key to submitting an accurate clear aligner order. We're not the ones physically creating the aligners. The company manufactures the aligners based on the information we provide. That is why submitting a precise order is essential, and to do that, I want to emphasize the importance of making an accurate diagnosis. So, I'll be discussing the diagnostic process in detail. And in clear aligner treatment, the only clinical procedure that the dentist is responsible for, aside from bonding, is IPR procedure. Performing IPR skillfully is extremely important, which is why we've included it in this course. So you'll have a chance to learn about it next time. And as for the concern, what if something goes wrong during treatment, you'll be able to take a big step towards successful outcomes by learning how to identify potential problems in advance, prevent them proactively, and prepare appropriate solutions when issues do arise. So, the main goal of our master course is to give you a framework to understand clear alignment treatment. And you can continue to build your knowledge by attending other seminars or reading relevant books. Whether you're taking the master course online or offline, I will focus on helping you look at the big picture of clear aligner treatment. Actually, the framework I mentioned is summarized in this simple numbered chart. At first glance, it might look basic, but in my opinion, this chart captures the entire workflow of clear aligner treatment. I always emphasize this chart in our offline master course. I show this chart repeatedly, in every session. It is meant to show you which step of the treatment process you are studying. So now let's review the overall framework. In clear aligner treatment, the very first step is to check the case difficulty. Just like a batter tells whether it is a ball or a strike, you need to assess whether a case is within your current skill level or not. I'll also share guidelines to help you make that judgment. I'll cover this part in the next session. Based on these, I've tried to classify the cases into 4 levels. According to this case classification, you can make a decision that you can deal with level 1 cases. And then, we go through 6 key topics: diagnosis, ordering, treatment initiation, treatment progress, addressing potential issues, and retention. By studying each topic step by step, and gradually building on them, you'll be able to perform more effective clear aligner treatment. So please make sure to keep this chart in mind. I will refer back to this chart throughout the course. You'll need to keep building on it. And when starting clear aligner treatment, you must understand the predictability of tooth movement. Even if we set a goal of achieving 100% alignment, the actual tooth movement when the patient wears the aligners can vary. Sometimes it's 100%, but other times it's only 50% or even 30%. This variation depends on many factors: patient cooperation, accurate diagnosis, and other factors. On average, we can anticipate about 70 to 80% of actual tooth movement. So there's no need to be discouraged if the results don't reach 100%. In general, clear aligner treatment rarely achieves a perfect 100% outcome. However, there are cases where the planned movements are achieved 100%, and we continue working to improve predictability. It starts with material development. However, when results fall short, we can address the gaps by performing a new scan and updating treatment plan. And even if we don't reach 100% at first, we can make treatment plan for overcorrection to reach the desired position. That's why understanding the predictability of tooth movement is so important, so you don't blame the clear aligners or feel disappointed. It's important to recognize this inherent characteristic from the start. To briefly introduce just two cases, here's a patient who came in with anterior crowding. Cases where the upper and lower anterior teeth are positioned labially and lingually tend to respond very well to clear aligner treatment. This patient falls into that type of malocclusion. While there are several diagnostic considerations, in this case, we decided to focus solely on alignment. The treatment was planned over a total of 14 steps, and the patient has been very cooperative throughout the treatment. By the 5th month, at step 13, we could already see significant improvement, especially in the lower arch. The lower arch showed significant improvement, but the upper teeth hadn't fully aligned yet. Our goal was to achieve this level of alignment by step 13, but as you can see, the actual result was slightly below expectations. Just because the result isn't perfect doesn't mean the treatment was unsuccessful. Based on our original goal, if we've come this close, it's actually considered a very successful outcome. At this point, we re-evaluate the current results. An important part of clear aligner treatment is asking questions like, why did the teeth only move this much? Are there any other underlying factors? In the next case, the patient visited the clinic with the main complaint of anterior crowding, and we proceeded with clear aligner treatment. There were no significant complicating factors, so we focused on aligning the anterior teeth. The lower arch was planned with 20 steps. The following images show the progress of the treatment, and this image shows the result at around the 19th step, after approximately 6 months of treatment. As you can see, the upper arch has aligned very well, while the lower arch has improved significantly, but still it isn't perfect. The alignment wasn't fully achieved. So, of course, we need to analyze the reasons behind this. When we do the next scan, we can provide appropriate solutions to address the issue. Despite good patient cooperation, the planned movements were not fully achieved. So, this may reflect an inherent limitation of clear aligner treatment. It could be seen as either a disadvantage or an advantage. That's why we'll take time to explore these key points through both our online and offline master courses. Now, let's go over the final topic: the treatment timeline. There are many clear aligner brands in the market, and I personally use several of them in my practice. But one of the key advantages of Magic Align is that it allows you to take a new scan every 6 steps. In general, the famous clear aligner brands provide the entire set of aligners, from start to finish, all at once. However, Magic Align allows you to monitor progress at multiple steps along the way. It doesn't always need to be 6 steps. You can request scans at different intervals, such as every 10 steps. This can be adjusted whenever you notice any deviation from the planned movement during treatment. That's a significant strength of the Magic Align. So if you're new to clear aligner treatment, I believe Magic Align can offer you many advantages. To give you a representative example, here's a patient with crowding. In this case, the full set of aligners was fabricated, covering the entire treatment from beginning to end. So the treatment progressed through to step 9 and then step 15, and overall, the teeth were aligning quite well. But around step 9, a gap between the aligner and the lateral incisor became noticeable, indicating that the tooth hadn't moved as planned. At this point, we would reassess and reroute the treatment plan. However, when the entire set of aligners is fabricated at once from the beginning, mid-course correction becomes more difficult. So we proceeded with the full set of aligners as initially fabricated, and over time, the deviation gradually became more noticeable. We will be able to compare the developments with the original plan. This monitoring allows us to make timely corrections when the treatment begins to deviate from the planned path. As a result, we can achieve successful outcomes. So, to wrap up, when studying clear aligner treatment, I'd like to recommend that you check each step in the chart I showed you earlier. You don't necessarily have to follow the steps, but I recommend going through each part, starting with diagnosis, learning how to make an order, understanding how to initiate treatment, and knowing what to monitor during the process. Then, when unexpected issues arise, you should be aware of possible solutions and learn how to maintain the results. If you study each part thoroughly, you will be able to develop clear aligner treatment plans and achieve successful outcomes. Although our time was short today, I hope this gave you a clear overview of how to approach your studies in clear aligner treatment. Starting from the next session, we'll begin with diagnosis and move through each of the key topics I introduced earlier. Once again, thank you for your interest in the Dental TV Clear Aligner Master Course. I look forward to seeing you in the next lecture on clear aligner diagnosis. Thank you for watching.